Welcome to eCareDiary.com's Caregiver Tips and Clips. I'm your host Meghna Kiritar. Each week we will focus on a caregiving issue in the form of a short education video. The subject of today's video is Senior Dental Care Myths. Proper senior dental care is essential as you age. Most believe that tooth loss goes hand in hand with aging. However, that is one of the many myths surrounding dental care among seniors. It is important to consult with your dentist for any queries and before taking any steps towards maintaining oral hygiene. Here are some key myths you need to be aware of. Myth 1. As you age, you will lose your teeth. The Academy of General Dentistry has stated that guaranteed tooth loss in seniors just because they are aging is not true. Your teeth are intended to last a lifetime, and with good oral care and professional dental services, they will. Poor oral hygiene and neglecting to see your dentist for regular dental services has more to do with tooth loss than growing older does. Myth 2. Periodontal disease affects all seniors. Periodontal disease or gum disease causes inflammation of the tissues and bones supporting the tissues and the teeth. Seniors face periodic gum disease conditions more than their younger counterparts, leading to some loss of bone and gum. But most research shows that many of the major periodontal treatment needs are very conservative and require non-surgical treatments such as scaling and localized root planning. Myth 3. Dry mouth is a normal part of aging. Research indicates that the flow and composition of saliva does not change with age. Medications and diseases can cause dry mouth, but if you're healthy, salivary flow would not undergo a change. Dentists can watch out for sudden changes in the saliva and recommend measures to restore the flow. Myth 4. Brushing your bleeding gums is bad. Brushing is not only good in teeth, but it's also good for gums and tongue. Brushing these areas helps get rid of plaque, which is what causes inflammation, gingivitis, and eventually gum disease. The plaque can cause the gums to become inflamed and bleed if not removed. If you have sensitive gums, it is best not to brush too hard. It is best to brush at an angle to avoid irritation of the gums. Brushing and flossing the surrounding areas will keep the gum tissue clean. Myth number 5. The whiter the teeth, the healthier they are. Your teeth may be white, but this cannot show if there is an infection or cavities between the teeth. The natural color of teeth vary from person to person. It is true though that as we age, our teeth may become discolored. This is also the case when they begin to break down. That's why discoloration could exist when you age, but it does not indicate unhealthy teeth. Myth 6. Bleaching your teeth is dangerous. Bleaching is a popular service used throughout the years with technology allowing for patients to get whiter smiles faster and safer. Before the year of 1990, the materials used were acidic and would break down enamel. But now bleaching materials are pH neutral and do not show any damage to the enamel or root of the tooth. Prolonged use of bleaching could, however, cause sensitivity, but once the trays are not used, the pain should go away. Myth 7. Eating sugar worsens the condition of your teeth. Sugar is bad for your teeth, but it's not actually the sugar that is hurting them. Bacteria in the mouth needs processed sugar to survive. If you eat a lot of processed sugars, you're more likely to incur a certain amount of tooth decay. Overall, the true cause of tooth decay is the combination of bacteria, sugar, and acid. Myth 8. A toothache can be managed by placing an aspirin next to it. Although aspirin only works when it is in the bloodstream, if the pain comes from the gum, aspirin can temporarily relieve some amount of pain. However, if it is coming from the actual tooth structure, the aspirin would have to enter the bloodstream to get through the enamel and get to the nerve. It is not advised to overuse aspirin or oral gels to relieve gum pain because these could lead to burn symptoms on the gums. Our final myth. Flossing is unnecessary. Flossing is an extra step many of us tend to avoid after brushing, but this can actually lead to buildup of bacteria. If a patient doesn't floss, the tooth surfaces that the regular brushing can't reach are not clean. Bacteria in those hard to reach places can cause gum disease, decay, and pain. Flossing is cheap, easy, and essential to oral health. The better informed you are, the easier it will be to take steps to prevent problems with your teeth or get it treated early on. October is Dental Hygiene Month, so take care of your teeth and for a longer quality and a better quality of life. Thank you for joining us today. To access more caregiver tips and clips, visit us at www.ecarediary.com. Until next time.